Repealing Obamacare has long been the goal of Republicans in Congress, and with a Republican president coming to office, it looks like they're getting their wish. But what happens to millions who've only had health care under this controversial law? What will replace Obamacare? Well, American International College professor of economics John Rogers spoke with Connecting Point correspondent Carolee McGrath to discuss just that.
Well, the Republicans have talked a lot about it, but I think it was Senator McCaskill said for 6 years we've been looking for the Republican plan up and down and we haven't seen it. So I think what they need to do is articulate the replacement or the alternative or how it's going to work going forward. And there are a lot of proposals on the table, but it's still a lot of uncertainty as to what's going to happen in January after the inauguration when they get started working on this.
Well, I think part of the plan had been to put in the repeal, but have it phase in a few years. Is that something that would give them enough time to replace provisions?
Well, it would, but you're dealing with complex insurance markets, and that could be very destabilizing. So I think there's a debate going on amongst the policymakers whether it's better to just try to do everything right away and then move forward with the new plan or give it several years. I think they're tending toward giving it more time, but I think that also has a downside in terms of the confusion that could result.
So in 2017, according to a report in Fiscal Times, premiums will go up by double digits in 31 states. And also the Department of Health and Human Services had a report that says average premiums will increase by 25%.
I think the really critical issue is the exchanges, which were supposed to be the mainstay of the program. So people who didn't have insurance with their employer or who didn't fall under Medicaid or Medicare. And Medicaid, remember, was expanded in all but 20 states. So a lot of people were picked up under Medicaid. But the people in the middle are directed to the exchanges, and for a number of reasons, those markets aren't working well. And a lot of the insurance companies have actually backed out of the exchange marketplaces. So that's where the real crisis is. And as you say, people are just being hit with big increases in premiums in many locations.
Is one of the reasons because some of the younger people are saying, listen, I'd rather pay the penalty for $700 than the premium if I'm a 27-year-old healthy kid?
Well, when the program started, government encouraged the insurance companies to get involved, and the insurance companies were hopeful that they would pick up a lot of new customers. But exactly that happened, that people who don't think they need the insurance don't get it. The people who do need the insurance buy it, and that is contrary to the way insurance works. Insurance only works when you have a lot of healthy people subsidizing a few ill people. If you have a lot of ill people, it goes into an adverse selection process.
How about letting consumers shop for the best prices for procedures?
Well, that would be the beauty of the health savings account. You'd have more incentive to shop around.
Because if you go in for a knee replacement, I mean, on your mind is, I want to replace this knee, not how much is it going to cost me. I'm not looking at that price tag. Or if you're going in to have a baby, you want to have that baby. You're not looking at how much it's going to cost on the other side.
And that's the basic problem with the healthcare market. If you go out and buy a new car, you might want a Mercedes, but you realize you can't afford it, so you buy a lower priced car. You don't do that with healthcare. There's not a competition between supply and demand that regulates a fair price. And so that would be one way to introduce that competition and that consumer awareness and change consumer behavior. But let's face it, it's much more difficult to do that, as you say, when you're talking about your knee or your baby than it is if you're buying a new car.
Okay, so this is a complicated issue that they're all going to be looking at just in a few short weeks.
They have their work cut out for them because there are 20 million people who've picked up insurance as a result of this. So whatever you might say about the program, those people do have insurance, and they need to make sure that in revising and rebuilding and re-engineering the system, they don't do something that's going to deprive those people of access.
Okay, Professor John Rogers, thank you so much for joining us today.
Thank you.